Hello, my name is Dr. Reza. I work as senior medical doctor in Balkh project in Afghanistan. Our work mainly focuses on clinical and socio-economic characteristics of patients diagnosed with tuberculosis in Mazar Regional Hospital. Afghanistan is, according to WHO, Afghanistan is considered a high prevalent country for TB. 180 cases of tuberculosis per 100,000 population. The latest data that we have from 2016 shows that there were 11,000 TB-related deaths, of which 20% of them were reported in children. This makes a huge number of 2,200 TB-related deaths in 2016 due to tuberculosis. We aimed since the beginning in support of the PICU, Pediatric Intensive Care Unit, by MSF to identify TB gaps, TB cases, identify gaps, and inform improvements between the period of June 2024 to May 2025. We created a line list and we analyzed our cases descriptively and summarized our data. During this period, the average admissions in our pediatric intensive care unit was in total 6,310 cases, which corresponds to monthly 459, 115 on weekly basis, and on daily basis to 16 cases. During this period, we identified 66 children with tuberculosis, of which 59.1% of them were diagnosed as pulmonary tuberculosis, and 36.4% of them were extrapulmonary. The remaining were mixed, both pulmonary and extrapulmonary tuberculosis. The mean time from admission to diagnosis in our patients was at that time 7.6 days. And the mean time from admission to start of treatment was reported 8.2 days. When it comes to our patients' characteristics, 53% of our patients were male, while 47 were females. The median age of our patients was 2 years. This corresponds to the sad reality that children under 5 years of age are the vulnerable population and they are mostly affected. Among patients who were tested, we had 24.2% positive gene expert results. This is aligned with the global results from similar contexts. And we had almost 60% of our patients who were having positive confirmed household tuberculosis. And 50% of them were having abnormal chest radiography. According to the WHO scoring, as we have implemented the treatment diagnostic algorithms, almost 94% of them were having a score of 10, which means that we could put them on TB treatment. And when it comes to the treatment outcomes, 4.5% of our patients were defaulters. And the sad part of it was that we had 22.7% mortality among those patients. This is because they are not early detected and came in a very critical stage. So this means the 1 in every 5 patients died. Our study concludes that diagnostic treatment and treatment delays increases the risk of poor outcomes. As we could see here, the 22.7% were dead. Also, we found that in our study that almost 60%, which makes 2/3 of the patients, were having confirmed TB case in their household. This raises the need for doing systematic and harmonized contact tracing for those patients. And we found out that those who were referred early and they were detected early and they were put on the treatment, they had better outcomes. And the 22.7 mortality, this underscores the severity of pediatric TB and also the need for timely diagnosis, lab access, and child-friendly treatment availability. During this period of our study, we increased the awareness using holistic approach, capacity building, and health education. We enhanced our cooperation because this is a non-TB, non-vertical project with the MOPH due to engagement of our senior MDs, regular meeting, and provision of medication, which this improved our diagnostic yield and we had greater efficacy. What we had before was 0 to 1 cases per month. Now we have reached increased our case detection significantly. Thank you.